My name is Ned Crystal. I was diagnosed with a myxoid liposarcoma. My orthopedic surgeon said, you need to go see a doctor at Emory, and you need to see him now, and you basically are going to have some very big choices that you're going to have to make within days.
I'm Dr. David Munson. I'm an orthopedic surgeon who's been at Emory now for 20 years. One of the things that I enjoy has to do with the ability to help patients who have maybe sought help in other locations and haven't been able to find answers that they needed. In some states, there are actually no existing fellowship-trained orthopedic oncologists, and so it's not uncommon for patients to travel often hundreds of miles to get the kind of services that we offer.
I think the biggest thing that I can say is that, if not for the grace of God and the doctors at Winship, I would not be here today.
Being at Emory allows us to see a lot of patients with very unusual tumors and difficult problems from the entire state of Georgia and the Southeast. My name is Shervin Escoe. I'm an orthopedic surgeon who specializes in musculoskeletal tumors. Emory allows us to offer the latest technology. One that I'm particularly excited about is a magnetically expandable prosthesis, which means that we can lengthen it with an outside source, a magnet that's placed around the child's limb. It's an implant that's used to reconstruct bone that's been taken out generally for tumors, such as sarcomas. The implant allows us to not only make up the bone that we have to resect, but also to grow as the child grows. We can put it in one time. We don't have to go back and re-expand it, which means multiple operations, so less blood loss, less chance of infection. If I can save a 5-year-old, 10 trips to the operating room between the time that she's 5 and 13,
right,
that's pretty awesome. Yeah. It's also a wonderful procedure in decreasing pain because we can expand the prosthesis more often in smaller increments, and the muscles don't get stretched as much, the ligaments don't get stretched as much, and it's a much more comfortable procedure. In fact, it's so comfortable it can be done in the office setting and doesn't require general anesthesia. We are the only center thus far that's put them in the state of Georgia.
The thing that brings the most pleasure to me as an orthopedic oncologist are the interpersonal relationships that I have the opportunity to develop with my patients and their families. That in and of itself is just really very satisfying and makes it worth coming to work every day.